Aloha, everyone. Welcome to the Baby and You Talk story for today. It's November 25th, 2025. And I have an amazing set of women here with us today. My name is Dr. Tara Lawal, and I am a midwife and a family nurse practitioner with the Rainier Valley Midwives. I also help the PI Health Board as a perinatal specialist, and I teach the Baby and You education course. Um, Alinda and Queena are here from our team. Could you give us a little shout out and who you are and what you do with the PI Health Board?
Oh, yeah,
Oh,
my name is Alan Dalek, and I'm working as a PBNU navigator, and it's nice to see everyone here. Hi, Moana, Quina, welcome, and Lika in the background. Tara, Dr. Dar, thank you so much. And we help with PBNU expecting mothers to come and get education, and help with PBNU class. I'll pass it to Quina.
Hello, Ogeta. My name is Quina. I'm a community navigator. I'm with the Pacific Islander Health Board of Washington. And I just recently, I'm working with Alinda and Lika, Dr. Tara as well, helping with the baby and you. So we're trying to help our island community, our mothers, prenatal care, and get our mothers checked in, help with the baby. So I'm so happy to be here and welcome on. Nice to for you to join us.
Thank you so much, amazing, beautiful ladies. My name is Moana Faifai. I am with the Family Ways program here at King County Public Health. And here at Family Ways, we support pregnant persons, parenting families, and children up to the age of 5. All services are culturally relevant, participant centered, and strength based. Our peer community specialists, such as myself, we represent the communities which we serve. And so I thank you all for having me again. It's amazing to be here tonight. Thank you.
Moana, we're so happy to have you. And I'm so glad that you were able to make time for us today. I want to congratulate you for being cancer free. You've been on a leave of absence and welcome back. And so, do you want to just share a little bit about your journey and how you got here today?
As far as Family Ways or
How about
my
your health
journey,
journey?
my health journey, well,
Yeah.
you know, I am one of those persons who was never really a fan of going to the hospitals or getting that annual checkup. And so um, I had I bled for 2.5 years, and yeah, basically I got tired of it, and so I finally reached out to my PCP, my provider, and set that appointment and went in and seen her and explained to her what my health issues were, concerns. And so, of course, she referred me out to OBGYN and got the process going to find out what was causing this. And so, fast forward, we found out there was a polyp in my ovaries and they found cancer in it. And so, immediately, I want to say 2 weeks after that appointment, we got the surgery scheduled for a hysterectomy. And, just to be safe so that things are not in there floating around, it was just best or recommended by the surgeon and my PCP to have a hysterectomy, just to remove it all. And so now I am following up with my doctors every 3 months for the first year to make sure that I'm I'm still cancer free. And so yeah, I'm thankful. I'm grateful to God that I am where I'm at today. I still have the opportunity to serve our community, to impact families in our communities. And I'm just grateful. And if I can give one advice to the moms, right, our sisters, nieces, grandparents, even, get that annual check every year. It's so vital, it's so important because we don't want to wait it's too late.
Exactly.
Thank you.
I feel like we need to have you come back on and we'll do like a whole topic just on annual screens and how worth it is, and how brave it is of you to share your story and what you've gone through in just 2 minutes. I'm so inspired by you just asking for help, because
Yes, thank
sometimes
you.
all it takes, but it's the hardest thing. And the hardest thing is to ask, and then you have to just trust that the person you're asking is going to listen to you and believe you. you
Yes,
know and especially as PI women, there's not a lot of providers that look like us. There's, unless you go to the islands, you're not going to find people that will take our experience, understand the stress that we live in, the ways of our land, our people, the way we sleep, the way we communicate with our families, and then
right.
treat us accordingly. And
Yes,
so it takes so much trust, and oftentimes we wait. We wait
yes,
till it's too late. And that's one thing we see here with our pregnant families, is that they wait until they're 6 or 7 months pregnant before they seek care. You know,
yes,
and so the reason we do these talk stories is so that we can hear from one another, so that we can connect with other community members and listen to each other and uplift one another. And I'm grateful you came here, because you bring a whole set of resources that we can start working together and tapping into. And so our goal for tonight is to ask you some questions about Family Way and how you can help our PI moms stay healthy and support them through pregnancy and all the way through postpartum. Um, I'm gonna ask Alinda some questions, and then maybe as she talks about what we see in the community, can you tell us, like, how does that connect back to Family Ways? So as we talk, just say, "Oh, in Family Ways, this is how you do it. This is how you connect to us." But you don't need a referral; just let us know. And then, because I want everyone to see, here's the problems and the things that we go through and what we're seeing in the community. And then here's the answers. There's so many resources. We just don't know how to connect them. So that's my goal of the show tonight, is that we'll be able to start seeing all the different ways that we can connect with people. Um,
awesome.
so, Alinda, we've been doing the Baby and You program for almost 3 years now. Um, can you talk about, like, some of the women that you are seeing, um, and why do we do what we do?
Thank you, Tara. I think we feel maternal health in our community, Pacific Island community, is important as like we value because we value family and we are the village and also collective well-being and we take care of each other and also um, we want to acknowledge that PI families face barriers like language translation and transportation, insurance, Medicaid, and also access to clinics and so many other stuff like resources. And Baby and You program is here to take care of that and help out with all the mothers in our PI communities. And we also have we we would like to recognize that giving birth and it's not just a medical event. It's like it's connect with community, our community and social and it's altogether like a community responsibility, socially, culturally, you know, and we like to take care of each other like sister. And Pacific Island women are facing difficulties with these things that I listed, but the most important thing that I want to share that it's really important for all of us is to take care of our babies because we are on top of losing babies, and it's not good. But with us community, we can help each other, reach out to mothers and our sisters, our communities. We don't want to keep losing babies, and so many mothers have come and we've filled with them, and it's really hard. It's it's also sad because it's also in the Bible. We cannot kill babies, and also we have to pray for each other and reach out to the community and help each other in so many ways that can stop peer community mothers to lose babies continuously.
Yeah.
Thank you.
This last year was, one of the hardest years for us in the PI community and within the women that have been coming to the talk story. We've had a lot of really sick moms, and they were sick before they were pregnant, and then pregnancy just exacerbates it. It makes it worse. If you're already not feeling good, it gets worse in pregnancy, and then it really affects the health of your baby. um Moana, can you kind of explain to us, like, how do we connect into Family Ways? What is Family Ways?
So, yes, thank you so much for sharing, Alinda. And what you were sharing, it takes me to, it reminds me of a lot of the work that we provide our clients and how we connect is the cultural relevancy of it all, right? And so here at Family Ways, we're fortunate to serve three different community groups, and that's the last African American, the Native Alaskan Indian, and then, of course, Native Hawaiian Pacific Islanders. And Tara, you mentioned earlier that it's important to seek the need and seek the help from providers who look like us, right? It reminds me of the whole trust issue, the stigma around our peoples going into clinics and automatically the doctors assume we have diabetes because we just run big, run heavy, thick, perhaps, right? So that stigma in itself, I know in conversations with clients, they have mentioned this. They're afraid to go seek help because of the stigma. And then also in connection with Family Ways, it's amazing because here we deal with or we provide services to pregnant persons or families, and in the age group that we serve is children up to the age of 5, and we all understand that in that age bracket of children, it's so vital that they get the prenatal help during pregnancy because it impacts and affects the children in that age bracket. And so here at Family Ways, also, we partner with a lot of organizations such as Open Arms and Hummingbird, Global Prenatal Services that provides um, these type of care for pregnant moms, PI moms, and we're blessed to also have a social worker on our team, a couple nutritionists that can provide nutrition support and services, right? And then we have a social worker. So not only peer community specialists, myself, which we are at the front line, but we also can refer our clients or families, participants to our NNS team, nurse, nutritionist, and social worker. And so, and I know further along we'll talk more about um, uh, how we can refer or take clients on. And so, yeah, I'll be happy to share that later on. That's just a little nutshell of what we do.
What do people have to do to qualify for your services?
Okay, awesome. Thank you so much for asking that. So,
Yeah.
no income restrictions. It is free. The only three requirements that we have is you have to identify with these three groups that we serve. You have to reside in King County,
Okay.
and you have to you have to have children within the age of 5 or younger, or
Okay.
a child that lives in the home in that
Okay.
age. Yes,
Does pregnancy count as well?
yes, for sure.
Okay. Perfect.
Yeah.
Do people have to be on Medicaid?
No, absolutely not.
Okay.
No.
So anybody who's PI, Native American, or
African American.
African American, they can, those three groups, and then
Yes.
just have a child in your home or be pregnant, we can
Yes.
set you up with resources.
Absolutely.
That's amazing.
Yes.
You know, there's been a lot of fear in our community lately because everything's contingent on insurances, and being covered by the right insurance or which insurance. And then so there's been a lot of changes that have been happening in the last, well, since August. I've been seeing it, especially within the hospital systems. Um, Most of my clients that we serve are on Medicaid, and a lot of the families that go to multi-care and live in Auburn, Federal Way, Puyallup, Kent are on Molina. And so we got this really scary letter that said, come January 1st, anyone who's on Molina is no longer going to be served by that whole system of multi-care. It was close to 500,000 people.
Oh man.
And so then we got a notice from UW Valley that said we're no longer taking all Medicaid patients in any of the outpatient care. So if you want to see us, we can't stop you from going to the ER. But all of them lost their appointments when they were going back to, for me in my world, it was everyone who was going back to their OB or their midwife, lost care. And so we had so many people just floating in the world, not knowing where do I go. And so there's been a lot of fear about what am I going to do in 1 month, and where am I going to go? Which hospital systems should I go to? I guess Mary Bridge is also part of the multi-care system, which is the South End Children's Hospital, right?
Right.
And so,
Yeah.
we are taking our transfers from Renton all the way up to Seattle.
Mm.
So they're going 45 minutes to an hour north, because there's no resources down south anymore. What are some things that you're hearing with the Medicaid issues?
Well, so I have some resources, clinics, hospitals that are, fortunately are still accepting families who have Medicaid, and St. Franciscan Health Systems. They are taking families who have Medicaid, such as St. Anne in Burien, St. Francis here in Federal Way, St. Joseph in Tacoma,
Okay.
right? As far as multi-care health goes, I believe Overlake Medical Center in Bellevue is still accepting patients who have Medicaid, Tacoma General for now. I'm not sure what 2026 will bring, but as of now, as we speak, multi-care Kent Clinic is still taking patients, and then multi-care Women's Clinic in Puyallup, right?
But
But
I
if
wanna
you
know-
have Molina, they will not take you.
in
So-
January, it's going to start in January 1st.
Okay, starting
You
Jan.
can also call the other plans to get them with
Yeah. I did get a hold of Community Health Plan of Washington, directly to the directors there. And we do have a contact person. And I asked, can I share it tonight? So we're going to share her information. It's Katie Zorb. You call her phone number. You could text her and she will change you like that within one day. If you're on Molina, she will switch you to Community Health Plan of Washington, and they will pick up the slack. They
That's
will.
awesome.
You can continue to stay in multi-care, stay within the system, and they will take that. Lika, are you able to put Katie's cell phone information into the chat and into the to the link for everyone? I just want you all to know that I don't want you floating. We can't afford, any of us, anyone who's brown, anyone who's Pacific Islander. If you don't know who your doctor is and you don't know where to go because your insurance has changed, get onto Community Health Plan. They are willing to take all 500,000 if they have to. So if you know anybody who says, "Oh, they won't take my insurance," please come back to us. Let's figure this out. I don't want anyone floating this holiday season. We can't afford it. We saw what happened to us during COVID, and we cannot let this happen again. Come January, I want everybody covered with their insurance. Okay? So please tell everybody that you know that we can take care of you.
Thank you so much for that, Tara.
Yeah, we can.
Thank you.
I want to add something. We're doing that in our office too. And you know our number, 253-235-5112. We can also switch your plan anytime you want. And we can help you also find care for you. Thank you.
And you know, it was just like you said, Moana, there's certain hospitals that will take us, right? And so I've been finding champions in every hospital system that if they say no, we're gonna find a back door, and I'm gonna just text a doctor's cell phone and say, "Hey, we have a situation. Can we come to you?" And they say yes. They understand how hard it is. It's not the doctor's fault. It's not the nurse's fault.
Right.
It's the system.
Right.
And this is how we fight back this system.
Yeah.
Is we have to come together. We have to be part of the community. All of our organizations have to work together to be able to find answers. So, I just think it took you 2 years to get help for cancer. Can you imagine how many other people, and you have resources, you work for the county, know, can you imagine everybody else that's out here that doesn't feel well, and they know they don't feel well, and they have nowhere to turn to?
Right.
So if anything, that's the one thing I want you to know. If you can't afford medical care, don't let that stop you.
Right.
Okay. There's different ways to access medical care, and we're working through all the different ways. We are burning.
Yeah, and I just want to add to that too. As we continue to receive referrals and families, we will definitely help navigate that system with them if they don't have insurance or if they want to switch insurance, because we've come to know that it's intimidating. Yeah. It's not easy to navigate the health system. So that is definitely something that we here at Family Ways, our peer community specialists, will help our families navigate through. So
now I'm going to kind of shoot some questions for you. Transportation. What do you do for transportation?
For transportation, we refer our families to HopeLink.
Yep.
And other resources within the county that can provide transportation. But we don't, unfortunately, we don't provide that directly.
But HopeLink is well connected. If you get onto HopeLink, you just call them and you say, "I have an appointment in 2 weeks." The thing is, you have to plan. You can't wait till the last minute. But they are good. If you have a last minute appointment, they will help you out. Yes. So you just call this phone number. We're going to put the HopeLink phone number in here. If you have any doctor's appointment, they don't care if it's up in Seattle.
Right.
If you're in King County, they will pick you up in Auburn and they will come to your house,
Mhm.
drive you to your appointment, and then they will have a cab waiting for you to take you home. And you don't have to pay for that. You know,
Yes.
the other thing is they will give you Orca cards if you need it. They'll pay for your gas money if you need that.
Yes.
It is available. Just nobody knows where to find it or how to get a hold of it. Um,
You can also call Public Health for that or call Lyft. Yeah, with Brenda and them, I can.
yeah.
Public.
HopeLink will get it to them too. They'll get them
Yes.
the Orca cards themselves.
Mhm.
Okay, I'm going to ask you another one. How do you navigate interpreter services?
So there is a language line that we contact. We're partnered with Language Lines where we have to call in and schedule our appointments with them in advance, or we can just call them the day of.
Okay.
For an example, when we schedule a meeting or a visit with our families, we can either wait until we get there, or we can schedule the appointment in advance, and
Okay.
it's been very, very helpful. And this is for Chiquis and Marshallese families.
That's amazing.
Can
Yeah.
I add up something?
Yeah.
Yeah, when you go to the doctor, like Auburn Health Point, and even if you call your Medicaid app, well, they provide the number through the telephone. It's very
Nice.
convenient.
If your doctor does not have an interpreter, you have to ask and just say, I need interpreter, I need language help, and they have to get it for you. Okay, so just know some of these conversations that our doctors have are complicated.
Yes.
And, if you have normal language skills in English, you can miss a lot of the context of what's happening in the situation. So it's okay to ask for help. It's actually your right to
Mhm.
understand what your doctor is saying to them. Hi,
Yeah.
Ala. I just want to hear what you say. Ala, we used to work with us. Shout out to Ala and all your help. She said, I feel like this is the only solution is for each of our communities to rise above, empower one another by sharing resources, educate one another. Thank you so much, Pip, for hosting this conversation. Ala, exactly. I think we are about to enter into 2026 and we have to be ready for it. We have to know who are the allies out here, who's supposed to help us, and you know what? Who's not going to help us? Because if they're not going to help us, we're not going to go there. And it's our right to say no. Like there's people that are doing actual harm to brown bodies like us. Okay. So I 100% agree. As we start to, we're going to see all the harm. We see it every day. Who is not listening? Who doesn't believe us? Who doesn't believe a mom in pain when she says, I feel that epidural? We just had this in class, right? A mom felt everything. She said the epidural didn't work. The whole time it never worked, and it's because she's a brown body. They don't believe brown bodies when they are in pain. And so, we all have to rise up. It just makes me so mad. And so what I love is like there are answers, but nobody knew about this, right? So I want to talk about which community partnerships can we turn to for help. So we have Family Ways, and that's part of King County, right? And so you help
Yes.
with access to healthcare.
Yes.
And then trying to get access to healthy foods, healthy systems.
Yes.
So Hummingbird is another one. Hummingbird Perinatal Services. They give you access to doulas.
Yes.
They have culturally appropriate care for your communities. They have so many fun organizational things that they do for the family. They have a ton of events. I have some dear friends that work at Hummingbird, and I'm grateful for all the work that they're doing. And so if you're pregnant, you can get straight into their care. We also have Open Arms Perinatal Services that provides doula services. They also if you can get into some of their programs, they follow you for 2 years.
Mhm.
So you'll actually have support all the way
Yes.
through the hard part of like having a little one. And within 2 years, sometimes people get pregnant right away. So then you have a 2-year-old and a newborn. And so
Mhm.
there's organizations like Open Arms that can help you through pregnancy. They can help you get resources. And like we're all looking for supplies. Thank you, Allah. She said, we are going to lose our resources if our community is not utilizing them and the programs for all of our people. So this is perfect timing for this conversation. Forever grateful for this conversation. I want to dig a little bit deeper when she said we will lose funding and we will lose the resources if we don't use it. There's so many times that we will sit in pain than ask for help. And we would rather sit in our shame and be embarrassed that something is hard, that, and I speak for myself, it is so hard for me to ask for help. And it's easier for me to work myself to the bone before I would go and ask for help. And Allah is right. If we don't use these resources, they're going to allocate it to a different community. We will lose it. And right now, the way that grants are set up and the way that money is given, all of us are pit against each other to get money as fast as we can. And so there's all these different organizations and nonprofits that are serving pregnant women all the way up to 5 years, and they're not funding us every year. They will fund us for 1 year and say, well, I hope we helped you, and then they won't renew the funding and we have to go search for more funding somewhere else, or we have to fire our team because we ran out of funding. We laid them all off. And this is something that's been really hard, is watching nonprofits. They grow and then they shrink and grow and shrink. And this is a year we can't afford to lose. 2026 is going to be worse than 25. This was bad. This government shutdown was horrific for a lot of families, and we are going to start to see that fallout. And this is the time where we need to figure out, okay, where do we go for? Where do I get basic needs? So, Queena, I'm going to turn some time over to you. Can you talk to us and tell us, like, where do we go for diapers? Where do we get clothes? How do we connect for just the basic things that we need?
So for mothers and families out there, like, we post a lot of resources on our Facebook page to show communities about resources that are available. And some of the places that we could go, our PIL board, the office at 5, we do give out clothing and diapers, toys to babies. Thanks to Westside Baby, they donate to us. We do have the Wellspring Family Services, Seattle, Babies for Homelessness. If you can call or text them to see you qualify. So you just have to call or text them and register to receive the services. They give baby supplies, diapers, all that. And the Children's Museum of Tacoma offers like diapers per week to mothers. So every Saturday from 1 to 4 p.m. You just have to go there, and I think you have to give at the reception, just say Monarch Diaper Bank, and then you can get the resources. And what next? Okay, pregnancy aid. We have Arbin, the first, second, third of the month, 10 to 1 p.m. And the first and second Saturday from Kent, Monday to Friday, 10 to 1:30 p.m.
Thank you. I think we're gonna put some of these, the list of some of these offices in the chat here for all of you. One of the easiest things to do is just go to the PI Health Board, because we collect a lot of stuff. There's organizations like Westside Baby and Wellspring. You have to have referrals there. So Westside Baby, we get some of the donations from them monthly. So if you want those resources, we have them here at the PI Health Board in the office. So just meet up with Alinda and with Queena and say, hey, I need, my baby is growing out. That's the big thing that we get. I was like, our baby is growing out of size 3s. We need 4s and 5s, or we need size 9 months instead. And so let us know, because we do get access to a lot of those resources. Alinda, do you want to tell me a little bit more about Alinda is very good at finding like the free lines of where to stand so that you get turkey dinner.
Well, I'm gonna talk more about WIC. WIC is USDA
Oh yeah.
nutritional and supplement program, also for wellness, and it's support with food for the mothers and infant and mothers, infant, and children up to 5 years old. Yeah, it helps with breastfeeding help, nutrition counseling, also local food partner pantries, and like food bank. They can help you with food when you need it. There's so many turkey tribe through this year that I share, and people are really happy and merry. I'm like, they're like, "Yay, good job, PIHP!" And they were also happy with Baby and You for giving out diapers over the Saturday. And they're really thankful, and they're like calling me. I'm like, "Oh no,
Thank you.
call Lika and Tara, Eli." But yes, and also WIC also program supporting gestational diabetes prevention, and important is keeping our PI rest. And we also do that with our Baby and You program. And I really love this class, Baby and You program. I'm working with them and helping Tara and Lika, but I'm like a mother too. I have 7 kids, and this class has been helping me with a lot of things, from sharing the needs and resources with my community and the mothers. Every day there's a lot of need with the mothers, and I'm so thankful for this program. I'm really saluting you, Lika, our director, and also Baby, and you are amazing, Dr. Tara. Everybody loves Lika. Everybody loves. Every time we get new mothers, there is always need, and we
Yeah.
need to help each other with this
Yeah.
program. I don't want it to stop. I want it to continue, and it really helps so many. It doesn't help only the COFA, but it helps the Spanish and other communities.
Yeah.
So, yeah, so let's help each other with this program. Bring us
So
clients from
you know
some.
what I love about what you do, Alinda? Alinda is a magnet for pregnant women. And then you find out somehow they're all related. And and this program that happens, it can only happen when you have somebody so rooted in the community like Alinda, because they trust her. Everyone who knows Alinda, when she says, "Oh, come to a class," they don't know what this class is all about. They just know Auntie Alinda told me I need to come. And I'm so glad, because, Alinda, every month it's like a whole new set of challenges that these families are going through. And, we've seen
Yeah,
so many challenges this year. Homelessness. We've
yeah,
seen diseases that have gone through the community. Hep B. We're seeing anemia like crazy,
yeah.
right? We're seeing really bad UTIs that cause preterm labor, right?
Mhm.
That's untreated. And so when you're pregnant and you don't know where to go, find Alinda. She will get you enrolled in our class. We start this Baby and You class once a month, every month. So we have a new cohort every month that starts. And even if you just come in the middle, we'll have you come, to the makeup classes the next month. So you really understand, and
Mhm.
lately we've seen some folks with gestational diabetes, to the point where we're like, let's just meet on Thursdays and keep each other accountable. Like, how's your sugar levels? What's going on? What kinds of food trigger this? What kinds of food help your sugar? And so as we meet, we're seeing new things that are rising up and that we can help with. I'm looking at the time, and there's things that I'm like, oh, there's so much to learn. Queena, can you help us talk about navigating the healthcare system?
Okay, so basically, like as Pacific Islanders, Moana and Dr. Tara already mentioned, like we hardly find anyone who is like us, who understands us culturally, how we think, and we are more of, we don't really speak up for what our right. We pretty much reserved and we just go along with whatever. So it's better to find a doctor or a midwife who understands us, who understands our PI culture and the way we do things. Because at the end of the day, they are the ones that will serve you, and it's better for you to be comfortable with them. So finding practitioners or midwife, and thank you, Dr. Tara. She's doing an amazing job. I went to a facility. It was so beautiful.
Oh,
Yeah.
thank
Yes.
It
you.
really help a lot. There's so many that come at last, like Trimster, and it's really hard. And Dr. Tara, it's very challenging, but thank you so much. She takes them and connects them with their specialized sector, and she just wanna get out there and help. And of course, we don't want to lose the babies, and we
Yeah.
want these mothers. And thank you so much. The class has been so helpful. Thank
You know
you.
what I've learned about our community members is, they are working 2-3 jobs, or their partner is gone all day working all these jobs. And then we're home with a lot of other families, with a lot of other children, and we're not in this, we're not in a routine or a set pattern. Like, we have a lot of people that are meeting their partner where they're at. Like, we have women that wake up at 3 a.m. because that's when their partner gets home, and they cook dinner. So everybody's up at 3 in the morning with their kids, and they're eating dinner at 3 a.m. And then we're always like, why can't they make it to a 10 o'clock appointment or 11 o'clock appointment? It's because they've been working, or they're up all night. And we asked, I asked Alinda, I'm like, she just got up and it's 4 o'clock in the afternoon. And then we realized, oh, we need to go see them at 10 p.m. And what's so interesting, we do home visits that late. And when we do the 10 o'clock home visits, it's perfect. It's like perfect timing. That's like their afternoon. And so there's people that they're living alternative lifestyles that we're not, accustomed to in America. But back in the islands, this is survival. And that's what they're trying to do, is working all these different jobs. And these moms are sick, and this lifestyle is keeping them sick. And so when we say we have to meet people where they're at, we got to be flexible. They're not going to come to 15 pregnancy visits. We'll be lucky if we get 3, and then we get them to an ER for their delivery. So we can't take on the burden as a group of midwives, but if we all share this burden, and we all learn to lift each other up in different ways, like the PI Health Board, they can get their basic needs met. Oh, Family Ways can make sure they can get to their appointments. Oh, midwives will actually see them and be kind. Okay, we can get them through this, and I really believe this, just like what Allah said, this conversation needs to happen, because it's not for just one organization to hold this. We all need to, this is what village means. This is what speaks to all of us, is how we work with one another. So I just want to. Oh, that was a good point that Lika brought up. Of all the different organizations out here that are helping to lift everybody up in so many different areas. Um, Gosh, I love what we do. I love all of you for doing this work and stepping into the hard. Like,
Yeah.
it is hard. If it feels hard, if you're crying because you had to go and support somebody through a hard thing, like, that's us showing up for each other. That's what showing up and helping one another looks like.
Yeah.
Um, we are all community. We are all villagers. We are all together. We're all warriors. That's what this is. When we're asking for the warriors to stand, that's us. That's this.
Absolutely. I agree. And thank you so much for the work that you do.
Thank you. Moana, can you close us out? I want all of you to think of one of your closing of how do you want to step forward this next year in helping community? What do you have to offer us? This is not in the program. I'm just making this up as we go because I feel like we need to charge forward.
Yes.
And what do you bring into this work?
Thank you for that question, Tara. So I know first and foremost is availability, being available, right? And then the cultural background aspect of it, and going above and beyond for your clients, meeting them where they're at, like you mentioned earlier. If it's not in their home, out in public somewhere.
Yeah.
For an example, I had my visits out in the streets because there was nowhere to meet, and you just have to show up for your families, show up for your clients. And there is no limits. I have to say there is no limit to it. If we have the resource for it, we can offer it. It's available. And again, here at Family Ways, you can refer them in as long as they're part of those 3 community groups we serve and they reside in King County, refer them in.
Okay.
We will take them on. And I'm excited to know now that Pacific Islander Health Board provides basic and essential needs for kiddos. I didn't know that until tonight, so I'm excited. So thank you so much again for the opportunity. I am so excited to lock arms and partner up with all of you amazing ladies and your programs and your services. Now I can take this and take it back to Family Ways.
Thank you.
I'm excited. Yeah, thank you.
Queena, I'm going to ask you too. You're new to the team. Welcome. We're just throwing you right into the fire. What do you have to offer as we move forward to our community?
As we move forward, we all left our island home. We all far from home. We only have each other. So as much as possible, we can only look after each other, share resources, keep the spirit of community, and that's how we help each other, and we are in this together.
Thank you. Alinda, how do you not get tired? How do you keep going forward?
Well, I always like to pray, first of all, and ask God for His help and guidance in every ways. And I also get help from my work, big support, and especially the community around me. All these mothers are teachers to me. I learn a lot from them and you guys. And I think we just have to share what we learn and listen, and rather than just, and I'm talking self not fix it, but just to listen and help them out, help each other, and we should also encourage these mothers to go to doctor on time and visit midwife, go to Dr. Dara. She's the best in support and helping and everything. She's knowledgeable and call us. Call us. We're here. Baby and You program is here for you to help you take care of your baby and take care of yourself. If you need help, don't be shy. Call us. We really want to help you. Yeah, and encourage also the partners, men, they need to get involved. Yeah, I think it's vital. It's really important. If the father of the baby will have full support for the mother, because you go through a lot of stress. You never know if you. Oh, it's a stressful thing to have to be pregnant if you don't have all the support that you need. It's important and plan, make time, make time for yourself, self care, and all that, and make healthy changes together for 2026. And I want to note that the Medicaid, Apple Health that we are enrolling, it's going to have a lot of big changes. It's not fun. It's going to be a mess. Premium is going to go high, and you might lose your qualified health tax credit. Yeah, so be prepared for that, all mothers, and let's help each other. Thank you.
Thank you, Alinda.
Miguel.
Woo! It's so funny, y'all were so nervous, but I just need to say some of your words back to you because this is how we're going to move forward. You said, I am available for you.
Yeah.
You refer them, we will catch them.
Right.
Bring them all in. We are going to keep our spirit of community. We left our islands to come here and we're all one of island. I love it.
Yeah.
Alinda says, I always start with prayer. And I get help from God. I get help from work. I get help from my colleagues.
And the
And
mother.
from mothers.
Yeah.
Yeah.
I learned so many things.
So many things.
Yeah.
I learned so much from all of you. This was so uplifting today.
Yeah.
I feel like, wow, this is why we do this work.
Yes.
You know, and I hope that all these families out there that are listening to us, we mean it when we say it. We are here for you. And we are striving to be better every day at the work that we do. This work is hard, but it's so rewarding. And it's why we keep going. That's why Alinda's not tired. It's because
I get tired. I'm a human being.
it's so rewarding to serve all of you and to see you become mothers and to see these babies that are healthy and their moms are healthy and they push their babies out. I'm so proud of them. You know, we're going to come up with our numbers for the year, but we did not have a whole lot of C-sections. We had vaginal births here. We did not have a whole lot of NICUs. We had a lot of babies that were healthy. We have a lot of babies that are breastfed. We have a lot of healthy weight babies that are not too big and not too small. Those are the outcomes that really matter. Because if we can stay within the normal, our babies are going to be fine. And they're going to grow into this next generation. There's a lot of healing that we are doing with each other. And then within these babies that we welcome. It has been a pleasure to work with all of you. I want to thank you, each of you, Moana, Alinda, and Quina. Thank you so much for joining us today. Thank you for everybody in the comments. Allah, we miss you.
Live and Lika. Thank you, Lika.
Thank you so much.
For your face.
So everyone, have a good night and aloha.
Happy pre-Thanksgiving, everyone.
Yes, happy
Yeah,
Thanksgiving.
gotta eat. Eat turkey. Bye. Thank you.
Bye.
Bye, everyone.
Bye-bye.
Bye.
Everyone.